Hi. So I'm starting to recognize some of these usernames like Marcel Y. Hello. Where are you from, Marcel? Hi, Lady P. Oh, thanks for the nice words about Jada and Ariana. Liz?
On my computer?
No, yeah, turn it off. Sorry, Liz's computer is going off.
Oh no, it's the ad for your video.
Okay,
The
just
current
just
video.
turn it off. Sorry, I don't know why there are ads playing now. Oh, California desert. Nice. Must be much warmer there than it is here. Oh, where you try a wig in the near future? Yeah, I don't know. We decided not to do that for now. I was actually going to go meet with someone to talk about hair extensions as like a fun video at her studio. And that was supposed to be this past Saturday, and that kind of fell apart. I don't know if she had to reschedule. So that didn't happen. But I ended up filming a collaboration with Cassandra Bankson, the skincare expert, and she has a pretty nice channel on YouTube, and it was really awesome to talk to. It was a lot of fun. So we did one video for her channel, one for our channel, and that will probably come out in about a week or so. So she was just yeah, wonderful to chat with. So that was great. Cassandra Bankson. That was a really fun collaboration. So, and then we're talking to Gavin Chen from the Victorian Institute in Australia. We'll be doing something with him soon. You guys, a few of you sent in your pictures to have us discuss them and give us your thoughts, give you our thoughts on your faces. So we are gonna put that together and do a collaboration that way, probably within the next month or so. So that'll be fun. Lady P says hi, Liz. And hi from Baton Rouge. Hello, Terrace. Yeah, Happy New Year, everybody. Better than thanks for donating, guys. Yeah, let's keep it going. So I think this is like the total amount that we've raised so far for the National Alopecia Areata Foundation, and partial proceeds of our sweatshirts, our hoodies, they go to the same organization. I've been trying to get a donation going, a fundraiser for the dachshund rescue, where we got our dog Remy, and so far we haven't been able to get YouTube to put them into like the options to select their charity. So until that happens, they're working, like Google, like YouTube's working on adding them in. So until that happens, we'll keep going with our favorite foundation, and eventually I do want to give to the Bucks County Dachshund Rescue. They've done a lot for us, and we're going to give back. And I'm going to match that donation, whatever it ends up being, for those wonderful dachshunds that they help. Can you do endoscopy, brow lift, and then a hair transplant? Yeah, you can do that. The sequence has to be right. I mean, you can do the brow lift first and then the hair transplant, but you'd have to wait about at least 4 months for things to heal up, and then you can do the transplant. And sometimes you get some alopecia at the scar sites from the endoscopic brow lift, so it's not a bad idea to sometimes put hair into those scars. Let's see. Love from Medico. Thank you. Oh, look, my mother's calling. Can't pick up right now. I'm doing a live. You had experience with clients that had short hair like a buzz cut, but still got a hair transplant to fill in the hairline, temples to frame the face. Yeah. Whatever their hair length, that doesn't, make them a better candidate or a worse candidate for hair transplant. Depends on the density and the quality of the hair, not so much if it's short or not. What should I do if finasteride has so many side effects that I can't use it? Well, if you're looking to still do medical therapy, we have other videos on our channel about medical hair therapy. So that includes minoxidil, it includes microneedling, PRP, laser caps, all that kind of stuff that I talk about, biotin vitamins. Some are more effective than others, but there are other things you can do if you can't tolerate finasteride. So it's not like an all or nothing thing. Hi, Tony. Thank you, Carolina. Jimmy Kimmel are my favorite shows to watch. I actually learned something from your broadcast, unlike Kimmel. Oh, that's really nice. It's actually funny because I got in touch with this pretty famous hairdresser who is coming in for a consultation soon. She's supposed to come in the next few weeks, and she treats like all the big celebrities. A lot of the people that I make these videos about are her clients, which is kind of hilarious. But that will be fun. And so she said she might not be able to come in on the day that we scheduled her because she might have to do something with Jimmy Kimmel's team, which is kind of interesting. So I'm okay if she chooses him over me for that day. Let's see. Leon, love you. Thank you, Carolina. All right. Yeah, so Kuna, so let's talk about these most recent videos. They're doing pretty well, which is not surprising in the sense that, the celebrity videos tend to do well on the channel. And, some of our other videos where we try to veer off in a different direction and give you guys something a little different. I know that the diehard fans appreciate it, but, others don't necessarily. So we have to kind of come back with the celebrity ones, and I think there's a lot to learn from them as well. So if you guys have any specific questions about or thoughts about Ariana Grande's video or Jada Smith's video, let us know. Um, Dawan, привет. Hi to you too. Um, After a hair transplant surgery, how long until I can go train in MMA or do Brazilian jiu-jitsu without damaging my transplant? So if you're gonna go like to do something that intense, I would wait 3 weeks if possible. Rob, that I think would be the safest way to go about it. How about a video for diet and nutrition for hair and skin health? Yeah.
Keeping track of the video suggestions.
Oh, okay. Yeah. Liz has a running list of these ideas. Yeah, I think that's a good idea. Diet and nutrition. I'm not an expert in that, to be honest with you. So obviously I know the basics, but that really isn't where my skill set is. So I don't love to pretend to be an expert in something if you guys haven't realized that. So yes, I can do like a cursory video about it. I'd almost rather discuss it with somebody, like do a collaboration with a really good dietitian and ask them more, pointed questions about pre-op and, post-op type of nutrition optimization, and also, talk about how it could affect the hair, the skin, all that type of thing. So that to me would be more productive than me just, I don't know, like reading some cursory book on it. We learn that in med school, but it's just not what I focus on. So I'll bring someone in and we'll chat about it. Right. How good or experienced are you at nasal osteotomies? I like how they said important question. Very experienced. I do a lot of rhinoplasty. You guys don't get to see a lot of it in the sense that I don't always do them for cosmetic purposes. As you know, I have a stint at the VA hospital where I work with veterans. I train residents there at Manhattan VA and the Brooklyn VA. And we're doing rhinoplasty there all the time, mostly for functional purposes. So people who can't breathe well. And sometimes we're correcting cosmetic issues. And in my practice, it's mostly cosmetic for the nose. But in cosmetic and in functional cases, we have to do nasal osteotomies, which means breaking the little bones in order for different purposes. Sometimes to straighten the nose. Sometimes it's because we remove a hump and now we don't want to have what's called open roof deformity. So we do the osteotomies to bring the bridge back together to recreate that roof. But yeah, I would say very experienced at that specific maneuver, which was a very specific question, but we appreciate that. All right. Have you had cosmetic lip procedures? No, I have not. I happen to have naturally good skin and full lips, I guess, from my mother, actually. And so, no, I haven't. I know some people theorize that online, but I would tell you if I did, I have nothing to hide. So, you guys will be the first to know if I get something done. Yeah, I haven't had a desire for it. Hello from Toronto. Hi, Sue. Can you do a video on Britney Spears? Yes. Liz, you wrote that down?
Mm-hmm.
Yeah. Yeah, we'll add her to our list. I don't think she was on the list. I remember Britney from like, were we in high school? Like when she was big? No, middle school. Yeah, middle school. She was blowing up, and what was that music video? She was on the boardwalk. There was a boardwalk there. Sometimes I run, sometimes I hide. Yeah, that was fun. Yeah, and then I don't know what happened to her, but a lot happened since then, for sure. But I'm glad she's free. Brittany has been freed. So yeah, but we should do one Brittany analysis. Microneedling for the face versus laser for 65-year-old lady. Hi, Evelyn. You know, both can work. It depends on what you're treating, and it depends on the intensity of each of those modalities. So microneedling can be done in different ways, different number of passes, right? You can do one pass, you can do two, three passes. Same with laser. And then the depth is different. So you can control it for microneedling, you can control it for a laser as well, depending on the degree of if it's a ablative laser or non-ablative laser. Ablative lasers go deeper, like a CO2. Non-ablative lasers are not as deep of a treatment. So it depends on your skin type as well, and depends what you're treating. Are you treating scar? Are you treating wrinkles? Different depths of wrinkles. So it's like broad question, but both have their place for non-surgical facial rejuvenation. Are dutasteride injections effective? Well, from my finasteride video, Rizzo, if you remember, I do talk about dutasteride. Usually it's not done as an injection. So I don't know if you're talking about like a topical subcutaneous injection or if people are injecting this stuff into their veins. I'm not really sure, but normally it's taken as a pill. Like in South Korea, it's approved as a pill for androgenic alopecia, and the side effects are generally more intense. Like the sexual side effects can be more intense and more at a higher frequency than for finasteride, but also you tend to see better results too as far as restoring your hair. So, but in the United States, at least, it's not FDA approved for hair loss. Monica, you're welcome. What would you suggest for hair loss above the ears? Been having recession there and wondering if you could transplant there. Yeah, I'm not really sure if you're talking about maybe just the temple area here or if there's a more specific patch that you have. If it's the more classic type of recession for androgenic alopecia, then sure, you can transplant that. If you have an area of like alopecia areata, which it's hard to tell from just the description, but if that's the situation where you have like a circular patch from areata, which is the condition that I have, as you guys know, and what we're raising money for. So, by the way, this is a fundraiser throughout this whole Q&A, and same with getting our hoodies. We send some of that money over to National Alopecia Areata Foundation. So make sure to donate if you can. But yeah, if it's alopecia areata, you have to be careful. You want to wait for stability, usually over the course of a few years, and usually the patch, the circular spot, will close up and heal in with hair. But if it doesn't, and it's very stable for a few years, you can sometimes consider a transplant into that. Okay, sorry, just trying to get through. I'm scrolling. I think as I scroll, yeah, I understand, but like the problem here is that like I'm scrolling down, and then all of a sudden it just jumps like 60 rows, 100 rows down, and so I'm just trying to like go in order. I'll do my best, guys. Is the shampoo matter for hair health? Most shampoos are marketed to like help regrow your hair, and it's a bunch of BS. Shampoo, there's ketoconazole, which can help if you have issues of androgenic alopecia and you have seborrheic dermatitis. It could help. Ketoconazole, antifungal shampoo several times a week can definitely help in controlling the microflora of the scalp. So that's useful. But beyond that, most of these shampoos don't really do a whole lot. I mean, they might make your hair look more like it has more volume, but not necessarily. There's nothing like a biological underpinning that they're targeting. Longest operation that you performed? So in my residency, in my training, we did a surgery that lasted about 24 hours. It was a really big basal cell carcinoma, like a cancer it started in the ear, but this person had some mental health problems and they just neglected it for like a long, long, long time. And basal cell actually doesn't spread throughout the body like some other cancers. It usually is locally destructive. So this basal cell had grown and had like taken up about half of her face. It was pretty disturbing. And she had like, she came in with like maggots coming out of her ear and like all this crazy stuff. So we took her to surgery and removed essentially, half of her face, and then the reconstructive plastic surgery team at that time constructed a free flap from her entire abdomen, and it was like put on like a pancake onto her face to close it up, to make it look as good as it could look. So that took forever. And we were as residents in and out. So like I left because in residency there's a certain number of hours that you can work, and then you have to go and take a break. They kind of force you to take breaks. So I had left. I went home, slept for 5 or 6 hours, then came back, and the surgery was still going on. So I went right back into the surgery. So that was probably the longest one. In my private practice, we usually, try to keep it under 6 hours for elective surgery, but I've gone a bit longer than that for like a facelift, brow lift, lip lift, when it gets into combination surgeries. But yeah, does PRP treatment replace medical therapy, or can I continue taking finasteride? PRP is technically just one type of medical therapy, and finasteride is another type of medical therapy. And so, frequently in my videos on non surgical hair restoration, I talk about combining modalities, so doing at least two things, because you don't know which is going to help you the most. And you don't want to necessarily do 10 things because then you really don't know what's helping. But we usually recommend a combination. So if you're doing finasteride, if you're continuing on that, then you could add PRP into the mix as well, and that would be good for medical therapy. For women with big foreheads, do you recommend front scalp reduction or FUT and use those hairs to fill the front? Great question, Zoe. I do have a video on hairline lowering, SHA, which is surgical hairline advancement, versus hair transplant, and there are pros and cons to each. So check out that video. Also, our next video to drop is going to be probably this Wednesday. And the video is a surgical showcase of surgical hairline advancement. It was a really nice, like the surgery just went well. I was very pleased with it. And she was a really super nice patient. So it just kind of was a great experience. And we recorded it. So as you guys know, with the bloody footage, even though the surgery was actually not that bloody, which was great, especially for surgical hairline advancement. Not that common for it not to be bloody, but the uncensored version is going to go on Patreon, and then the censored version with still the same commentaries, just not as much that you'll be able to actually see. That's going to go on YouTube, so check it out. A lot of our viewers don't like the bloody stuff, so they enjoy that we censor things, and also YouTube doesn't appreciate it for the most part. So that's why we've created another place for that content if you really want to see it all. So that's coming out this week. So it's a good question, and again, depends on the situation. There's no one answer for that question. Dr. Linkov, do you use endotyne implants for brow lifts? Sometimes I try to avoid like full-on brow lifts that raise the central brows. A lot of us are moving away from that and focusing more on like a lateral or temporal brow lifting that addresses the lateral eyebrow as opposed to the entire complex. Because when you lift the whole complex, people look very surprised and kind of frozen. And so there's a move in the field away from that type of surgery. But yeah, if that's done, if I do that and we use like several ports, and I don't really like endoscopes, and what I mean by that is like I like the endoscopic style of approach where you have several small incisions as opposed to one big one like you guys saw in the Jada Smith video. I mean, look, maybe it was not a coronal brow lift. I don't know, but that's a scar that you could get from a coronal brow lift, and her brows look raised. So I think that maybe is what she had, but could it have been a scar from wearing weaves or so, which is what someone pointed out? Maybe, but I think less likely for such a deep, kind of thick scar from weaves. I don't think so. So yeah, but that's like an old school scar. So like these days it would be smaller little incisions, but I don't like that the use of endoscopes. Like whenever I can avoid it, I don't use endoscopes. So like this area here, a lot of it can be done based off of feel and knowledge of anatomy. And so you don't have to be seeing it on a screen and have this endoscope that's going to get in your way to do a proper brow lift, especially not for a temporal. You can do very direct visualization with the headlight. You don't need an endoscope per se. So, but the endotines are a different discussion, and yes, they are helpful. And when I do a surgical hairline advancement, which is what you'll see at the next video that we post, that one, the endotines are placed in a similar location to a brow lift, except they're placed in reverse, if that makes sense, because the endotines have the endotines, for those who don't know, it's a dissolvable type of material, and it's basically made out of suture material, but it has these little like barbs on it. And so the idea is when you bring the scalp back and then you're trying to pull it down, you're bringing the hairline down, you don't want it to recoil back. And so the endotine, you have to face it sort of this way, where you have the anchor here, and then it fans out this way with, it's kind of hard to explain, but you'll see in the video that we post. But like then there's like these prongs, and so you want the scalp to come over the prongs, secure down, and that's what keeps it from going back. For a brow lift, that's the opposite. So you kind of have it in this trajectory. So you bring the forehead up, and it sits on these prongs. So another thing to keep in mind with like endoscopic style brow lifts is that you're actually bringing the hairline up. And that's something to keep in mind. So for a patient with like a high hairline who also wants a brow lift, it's perfect to do a surgical hairline advancement. Again, if they're a candidate for all the other reasons, because you can address both at the same time. So that could be a nice option. Dr. Linkov, I have a consult with you for July, lip lift in July. Great. That's awesome. I'll see you there. I don't know how soon after we can do surgery, if that's what you were getting at. We'll see how the schedule looks. How long have you been in practice? My private practice, almost 4 years. How much schooling? I mean, my whole life. So I'm 36 now. I finished schooling. I mean, meaning all the training. It's not school after a while. It becomes just your training. But because you get paid in residency and fellowship, you get paid. But finished all that when I was 32. All right. Were you gifted as a student? I did okay. I mean, I wasn't like always the best in class, but I did okay. After a hair transplant, why the new hair ain't damaged by the autoimmune or hormones? Um, well, if you why new hair? If I understand the question correctly, so yeah, if it's your own hair that's being transplanted, as long as you don't have an autoimmune condition like I do that destroys your own hair, then the hairs grow. I mean, that's, they don't always all grow, but as a general rule, it works. So, yeah, let's see what other questions. Do you have any, Lizzie?
Give me 1 second. I just have to.
How much will the lip lift drop? I'm 2 weeks post-op and love how short my philtrum is. Don't want for it to get longer. Well, as we age, the skin on the body elongates, and so this area can drop just like after a facelift. Things over time can drop, but we don't know exactly by how much and when. I get that question a lot. There's no way to really know. But you don't want to over correct either when you're doing a lip lift, because then what if it doesn't drop by much for years? Then you're stuck with like an overly lifted lip. So it's got to be done just right. Um, Sam, I'm studying as a pre-med for the MCAT. You inspire me. Well, thank you. Thanks. Yeah, just gotta follow your dreams, do what you love, and the rest will follow.
I have a question.
Yeah.
One that I thought was interesting. Well, microblading, like for the eyebrows, I'm guessing.
Microblading for the eyebrows. Yeah.
Will that impact how transplanted hairs will take if someone decides
Yeah.
to do a transplant down the road?
That's a good question. So yeah, so if you do, so the question is, if you've done microblading, or if you plan on doing microblading and then later maybe getting an eyebrow hair transplant, will the microblading impact on the survival of the hairs for the transplant? And the answer is no, because the ink is for microblading or for scalp micropigmentation, which is another video that I have to make, which I just haven't gotten around to it, but it's on my list. So that ink is placed fairly superficially, more superficial than like a regular tattoo. And so the hairs are placed much deeper, right? The hairs are going in like 4 millimeters, and the ink is like at a millimeter max. And so it's really not going to impact the outcome. And we do it all the time. So that's a good question, but it's nothing to worry about. Now, if you had an eyebrow hair transplant and then you go and try to do microblading, you have to be a little careful not to shock the hairs, especially in the early period. You got to wait for the healing process to take effect before you go and do something like that. But that's a good question. All right. Let's see.
And you want to pick another random one?
Chemist researcher here. Nice, Abigail. That's awesome. We are actually in the process of trying to formulate or find a formulator for like a scar gel. We're interested in making our own scar gel, and so that will be cool. So that's coming. Is it true that scalp? Go ahead, Liz.
Oh no. Another one that someone asked I
Mhm.
thought was interesting
Another question.
was about with time
Mhm.
dropping after like the philtrum kind of after a lip lift. Like, what are
Yeah.
the chances and how long
Yeah,
do you expect for it to
I
kind of
already
drop
answered
again?
that.
Oh, you got that one? Oh, I
Yeah,
missed
while you
that.
were busy.
Yeah.
Uh,
Okay, sorry.
let's see. What do I do if my head is always so itchy, even if I use Nizoral or Head and Shoulders shampoo? Honestly, I would talk to your dermatologist, because sometimes there are different skin conditions that it can affect, different parts of our body, including the scalp. And I usually just refer out to derm. They have all the different. Sometimes you need a steroid to bring down the inflammation that might be causing the itch. Sometimes it's allergies, it's different things. But usually I'll refer out for that, because it's just not the focus of my practice to figure that out for people. But yeah, that's a good question, and that does come up once in a while. And sometimes another good thing to discuss is like for a hair transplant. Occasionally, I'll get a patient who's prone to like a lot of folliculitis, or has pretty bad case of seborrheic dermatitis. And what we tell them is like it just has to be under good control prior to a hair transplant, because a transplant can exacerbate it. And what we don't want is an active inflammatory state that can jeopardize our transplant results. So when I see like a more extreme form of that, I send them to dermatology, get that under control, and then come back, because we don't want problems with the transplant results. Let's see. Much or less, I've already answered that question earlier in this talk, but thank you for the comment. Let's see. Lexa, I am a hip hop artist. Okay. Um, why do we not lose hair on the legs, armpits, pubic hair? Well, people do. Well, for one, I did, right, because of my autoimmune condition. But yeah, it's actually not uncommon. So I do occasionally get to do some pubic hair transplants, and so it's for men or women. But women, in post-menopausal state will, start to lose hair, and that includes on the pubic region, and that's not talked about as often. But I've had some patients like that who've wanted to get hair back. So, you know, um, is there anything I can do to prevent hair loss in the future? Well, watch our videos and you'll find out what you can do. We have a bunch of non-surgical hair videos, and that's the best stuff for preserving what you have. Hair transplant brings hair in to a place where there's no more hair, but the goal ideally is to preserve what you do have. Could you please do a video on preventative Botox? Yes, Anika, I can. I think that's a good idea. As I've gotten busier in the practice surgically, I've started to do less and less injectables, because patients now are calling in waiting until July for consultations. So it's like most people won't wait that long for like Botox or filler. So I still do it for patients that have been coming to me for years, and for individuals who are referred by colleagues specifically for that. And sometimes for other doctors who, I'm already, I kind of know. So I do it. It's just not at the same frequency as I used to. But I used to teach it. I used to teach injectables to other doctors. So I'm very, very well versed in it. And I'd be happy to make more videos about it if you guys are interested. And I've actually started looking for like a PA or an MP for the practice who I can, who so maybe already has a lot of training in injectables, but who I can also teach my style of injecting, which is a very natural type of way of injecting, and get them to do that within our practice. So I'm working on that, but that doesn't happen overnight. All right. So Brittany isn't free. Oh no, I thought she was free. Let's see what else. Well, does Rogaine work all over the scalp or just certain areas on top? Yeah, it can. It can work. Can even work on the beard area, which is what some people use it for. Let's see. Hi from South Africa from Ethan. Two-part question. If you have recession in the front, do you apply minoxidil to the entire scalp? You don't have to. You don't have to. You can focus on that area on the front. And then two, what is your opinion of ketoconazole? Uh, Apparently, it is hepatotoxic. Usually not from a topical application a couple of times a week, but antifungals in general can be hepatotoxic. But even people who treat, I have an immunologist who gives flutoconazole, which is antifungal pill, like a month straight. She gives it to some patients to kind of clear their system of fungus and yeast and whatever. Even those patients do great unless they have some pre-existing liver condition. So I wouldn't worry about a ketoconazole shampoo several times a week. Please do a video on Chrissy Teigen. She recently had buccal fat removal. Yeah, she keeps doing more and more procedures. Yeah, I mean, I did a video on buccal fat removal, as you guys know, and then I did a video on eyebrow hair transplant where we touched on Chrissy Teigen, though the focus of the video was on my patient who had an eyebrow hair transplant with me. So we've kind of touched on both of those topics in different videos. Let's see. Okay. I just was about to read a question and it skipped ahead. Oh, thanks, Grasak. I appreciate it. Your voice is soothing. Thank you. Some people find it annoying, but I'm glad you guys find it soothing. uh, okay, Liz, anything?
Let's see.
Oh, rib removal to decrease the
waistline.
Yeah, I don't do body plastic surgery, so I don't know too much about that. But yeah, I mean, rib removal, I've done in my training for rhinoplasty revision. I don't harvest from that area anymore, but I think this is for a completely different application altogether. I'm just not too well versed in that. And Bob Saget, yeah, R.I.P. for sure. Full House, amazing.
Another, someone had asked about, and you might have probably addressed this, but like thoughts on doing beard to scalp hair transplant.
Beard to scalp?
Yeah.
Yeah, beard to scalp we do. We don't do it every day, but for the right patient, we do. So if you exhaust, so it's not like a first choice, right? You always want to use scalp hair whenever possible. But for people who present with like an exhausted supply, or if with me they've had several procedures and still want more, then we sometimes will go into the beard area if they have beard hair as the next favorite source of hair to harvest. And the reason we don't go, like some people ask for like pubic hair, or they ask for, I don't know, arm hair, is because those areas are less likely to be in the anagen phase, and they're less likely to actually grow well, predictably in wherever you're putting them. So it's scalp first choice, then neck, then chest and or back as the next. I usually don't go to other areas as for donor supply.
And then another, comment that that I thought was a good question, because you don't because it doesn't come up a lot, but just like microcia surgery for
Microcia
ears.
surgery, yeah.
Yeah. Just like, what are your opinions on it? And maybe you can tell people like what that is, because I know
Yeah.
it's not common.
Yeah, so some people are born with a congenital sort of malformation where the ear is not fully formed, like the outer ear, and sometimes it's actually a middle ear and inner ear problem as well. But a lot of times it's just the outer ear that is underdeveloped, and there's like lots of different versions of it. And there aren't that many people. There are people who specialize just in that type of surgery. I'm not one of them. I do some otoplasty surgery, but that's like correcting a very minor issue compared to what microtia is, where you have like almost no ear.
Or macrocia was actually the big. I guess I don't know.
Well, I don't know
Yeah.
microtia, but whatever. So like basically, like usually these surgeries are done when in children when they're much younger, like 5 to 7 years old. Sometimes it's done later in life, but usually younger. And it's a very involved surgery if you're doing like the old school reconstructive, where you get like 3 ribs and you have to carve it, and then you create an ear out of it. And it sounds glamorous, but really usually requires many surgeries over time to make it better and make it look more normal. And so the more modern day approach is actually like an implant type of thing, where it looks very natural, and there's like a pin that's implanted in, and then you basically hook this like ear looking thing into the pin, and it's fake, but it can be replaced. You can change it as the person grows and gets older. So if it were, God forbid, anyone close to me or anyone close to you guys, like that's what I would recommend over the major reconstructive surgery, where the ear will still never look totally normal, and yet these young kids are getting like long periods of anesthesia and risks of surgery and all that kind of stuff when they're much younger. So that's my 2 cents. And then there's also tissue engineering, which has some promise, but similar to like hair cloning, God knows when that will actually come to fruition. But maybe one day we'll be able to tissue engineer cartilage. I actually worked on some of that research in both medical school and in residency, tissue engineering of cartilage. But we're still a ways off from that. But it'd be great if you can do like entire blocks of cartilage, and it can be useful for rhinoplasty too. And that would be great if we have another source of cartilage. But for now, we don't have that prime time. What else? What else? Do you customize lip lifts for each patient depending on what you think would look best? I want a nugget, more enhanced Cupid's bow, middle area, but some people just want less upper lip space. So yeah, so I mean, it's customized to a degree. The general steps of the procedure with my like lift surgery, which is a type of bullhorn lip lift surgery, that doesn't change a whole lot from person to person. The steps don't change, but of course you have to adapt to the anatomy of the person's base of the nose, and you have to go with like what their anatomy is as far as proportions and what they're looking for. So there is customization on that front. But when you're talking about the Cupid's bow really doesn't change a whole lot with the lip lift surgery. It's basically maintained. So if you have a well-defined Cupid's bow, it's going to be well-defined, just lift it up. And if it's poorly defined, there's no good surgery to define it better, because when you start to make cuts on the actual Cupid's bow, it always ends up worse. So I don't recommend that. What dose of spironolactone is best for women's hair growth? So honestly, it's a good question. I kind of stay away from prescribing spironolactone, just because it has electrolyte disturbance problems, and you have to be monitored for it. And so I usually will leave that to a primary care dermatologist to manage. But there's definitely evidence in general of spironolactone helping with women, especially women's hair. Tips on skin sagging other than a facelift. Yeah, it's a good question. It's a simple question, and yet it's a complicated one at the same time. So, yeah, and Dr. Subio, who's on Instagram, actually had a really nice post recently about that, where he showed a woman who, I guess she's like a pilot and flies like military planes, and she's maybe in the Air Force. And so it was showing her, at rest, and then showing her flying with like somehow 7x gravity for gravity forces. I'm not really into like aviation and stuff, so but somehow it was like 7x gravitational forces in whatever plane she was flying. And you can see with the gravity how the face was just like sagging temporarily for those brief seconds that she was under those forces. uh, and it just like proves the point that there's so much, that happens with just the sag and gravitational changes with sag over time, a lot more than people appreciate. And so when we go and we try to lift faces with filler, which is what a lot of people try to do, it's not really addressing the main problem that's happened over time. Yes, there's volume loss, but the driving factor usually is like gravitational sag. And so the point of that clip that I mentioned is that when this woman stopped being under those forces, which was just a few seconds, the face became lifted again and it looked like her prior self. So it's not really an issue. And then when she was under those forces, she looked like an old lady. Uh, so lifting is often the best thing that you can do, as opposed to just going in and filling people up with, tons of syringes of filler, where they look like this oversized, doll face, and they never quite look natural again after a while. So uh, now lifting is can be done surgically. Are there good non-surgical ways to lift? I wish there were. I wish there were. I really do. At the end of the day, there aren't too many great solutions. You have thread lifting, very temporary. I'm going to try to, if I have energy tomorrow morning, I'm going to try to film a video um, on, because we had a block, we had to move a patient because of our anesthesia team to Wednesday morning instead of tomorrow morning. So I have a little bit of a window. I could do some filming. So I might do one on thread lifting, like a DIY thread lifting reaction video, which I think would be fun. I haven't talked much about thread lifts on the channel. I don't do it in my practice, but I know a lot about it. And yeah, so that's one way to lift the skin. You can do like radio frequency tightening of the skin. Does it really lift the skin though? Most people feel that it does not. And then there's also maybe Sculptra, which is another way to do it, where you're building up collagen. Does that lift? Maybe a little. So there aren't too many amazing options for lifting sagging skin other than with surgery. But there are some non-surgical things, and people explore them. And I would say a lot of people are dissatisfied with their results, but I guess it depends on what your goals are. Are you familiar with the Y facelift? Do you recommend it? Yes, as far as I know, the Y lift is a procedure that an oral surgeon in Manhattan, who I kind of know of through, what do I think, like my mom's friend knows, like that guy's mother. But it's an oral surgeon. He came up with this lift, and there's nothing that revolutionary about it, but it's essentially Radiesse, which is like a certain type of filler, not a hyaluronic acid based filler, a different type of calcium hydroxyapatite filler. And this filler is placed deep onto the bone, and so it's supposed to enhance your bone structure. And I believe I heard that Madonna had it done with him, and her face started to get just bigger. I mean, with all this filler over time, the face just gets bigger and bigger and starts to look less and less natural. But the reason it's called the Y lift is because it's radiance applied to the bone along this type of trajectory, meaning not so much into this area, but usually the chin, and then usually the cheekbones get filled. So that's why he called it the Y lift. And yeah, I mean, if that's what you're interested in, more power to you. I would never let a family member get that done. I'm not a fan of Radiesse. I've done surgeries where Radiesse has been placed in the past, and then when you create a flap of skin, when we're doing surgery, and you're seeing all these like white deposits in the skin, and usually that skin flap is less vascular because all this crap that's been injected into it, especially Radiesse, compared to like an HA filler. So I'll take HA fillers any day over Radiesse. Uh, I don't inject Radiesse. I hate Radiesse. There's also no reversible agent. So if you were to like develop a nodule from that, you'd have to go and cut it out, or inject it with like steroid or 5-FU or something like that. But it's not great. It's not a great approach in my opinion. At least with HA fillers, hyaluronic acid fillers, you have hyaluronidase that can try to reverse it. Should you be concerned if the nose is completely flat when pressed on, as if there is no septum? Never had surgery of any kind. So that's common, especially in certain ethnicities, that can happen. And sometimes it happens as we age and structures weaken, and sometimes we're just born that way. So, like when I turn profile and I press on the tip of my nose, you see there's like, well, I have a robust nose from my heritage, but you can see how like there's limited ability to kind of really press it into the face. There's limited like there's a lot of recoil, and there's not as much compressibility. So what that tells me, and what that should tell you, is that the septum is quite strong, right? Because it's resisting the force of the finger. When you do that to someone who has a very weak septum, it just collapses in. It just collapses in. So yeah, that does mean that there's a weak septum, and it can be strengthened, right? So I do surgery, especially at the hospital, where we strengthen that central support, and that can help people breathe, actually. That's the primary reason. And some people like it for just appearance sake, but it does help oftentimes breathing, because now you've lengthened the nose somewhat, and you've increased your external nasal valve, which is the ability then to take air in through your nose. So that's a common test that I do when I'm dealing with functional rhinoplasty patients. Is I do that test to see, if they have issues breathing, does that help them? The other thing I sometimes do is I take like these two Q-tips and I put it just on the inside of the nose, and I pull out this way, that way, forward, and I ask them, like, are you breathing better? And usually the answer is yes. And if that's the case, then I know that there's a good chance that my surgery with strengthening the central septum, well, it is in the center, but really the caudal septum, which is the front of the septum, strengthening that will likely give them functional benefit. So that's cool. Thank you guys, by the way, whoever's donating to the Alopecia Areata Foundation.
You should give out a shout out to Bobby.
Bobby?
Yeah.
Bobby gave money?
He's like the hype man. Yeah, he was trying to encourage
Thanks,
everyone.
Bobby. Bobby, thank
Bobby
you.
Shay, who's really, I think, the water boy.
We got
Yeah.
Water Boy here pushing this foundation, this fundraiser forward. So that's cool. What else? What else? Thank you so much, Liz NYC. That's the first I've admitted any of that, but figured it was worth it. What did she admit, Huntress?
I'll show you their story later. But she told a story about kind of all challenges that she's gone through.
Challenges.
And medical issues she's experienced, but
that's nice.
In the end, she's donating a lot of hair to children with alopecia.
Oh, nice, Huntress. Thanks for the donation of hair. Yeah, we can donate money or we can donate hair. Whatever you have. If you have money, great. If you have hair, great. If you don't have either one, then just enjoy the chat and sit back. Let's see, Greg. I would love something forward to a video on why people get anxiety about losing hair. Yeah, I mean, I think that's good to talk about. Listen, it's something that is very prevalent amongst men and women, and why it happens. It's just, I think people are worried about how they're going to be perceived by others, and they're worried about maybe the work opportunities or the interpersonal, like relationship opportunities that may be, open to them if they were to lose hair. I think that's sort of the biggest fear factor for people. And for me, like my hair loss, like being out here talking to you guys, making videos, like owning it is like cathartic. And I mentioned in the beginning of this whole chat today that on Saturday we did a collaboration virtually with Cassandra Bankson, who's phenomenal, by the way, and she's had her own battles with acne, and she talks about that on her skincare channel. And we both agreed that it's very cathartic to come out and talk about it, and get people's input. And most people are you guys are mostly very positive and supportive, and we appreciate that. And that has helped me. And also, in my line of work, it's oddly satisfying to be able to give someone more hair, even though I'm not in a position to do that for myself. So it's kind of like an interesting way of helping myself cope. So I don't know, but for sure, like in the beginning, I remember being worried, like, oh, how will I be received? Will this affect my work? How people think of me and whatever. I don't know. So yeah, all those worries I think build up anxiety. Uh, Dr. Linkov, can you teach us more about ENT? Z, I've thought about it, but it seems like it's tricky, right? So yeah, so ENT pathway training procedure. Yeah, like I have a lot to offer because at my core, that's my core specialty, as you guys know, ENT head and neck surgery, and then the facial plastics and the hair surgery. Those are layers beyond that. I had to go through to get that experience and knowledge and expertise, but it all builds on top of a solid foundation of ENT and head and neck surgery. And I still very much have an interest in that. And then when I'm at the hospital, I still do some of that. Um, so I would love to teach about it. It's just problem is when you build up. Well, first of all, my practice, I don't do any of that. So we have a very focused practice, and then the YouTube channel, which is essentially a reflection of the practice, is also now very focused. So if we start to create videos that are very different, we've even experimented with that here and there, like with the cranial manipulation by the chiropractor, or we've done different reaction videos that are a little bit different, like the phase gym. They do okay, but the videos overall don't do amazingly because people are used to a certain type of content. So maybe either the channel grows so big that like doesn't really matter at that point, I'm not sure, and we just start to introduce more ENT content, or we carve out like a new channel one day and start to put ENT things there. But it's tough because like I'm balancing that with like my clinical practice, and which is getting busier and busier, and the hospital work I do with, of course, keeping up with this channel. So there's only one of me, and a great family that I spend time with too, and so it's tough. But yes, in the future we're going to try to figure out a way maybe of talking more about ENT related things because there's so much out there, and I don't think that there's anyone doing a great job on YouTube teaching ENT as far as I know. I mean, like ENT for the masses, where people can really like learn about, basic ear conditions and nose conditions and throat conditions that help you get a better understanding of common day, things. I mean, these are like people are always, having some issues with those things. So how do you begin to understand the different things that can go wrong, and proper treatments and all of that. So yeah, so maybe we will do more of that eventually. Why on earth do we have the term ethnic rhinoplasty? I find it to be uh, problematic. I understand there are key structural differences at times. Sure, I am mixed race myself. Yeah, I get it, Ryan. I understand your perspective. I will play devil's advocate here and tell you that uh, there are many patients who have what some call ethnic noses, right? That look for doctors or people who can perform these procedures that understand their nasal anatomy. I mean, noses are not all the same, and there are certain features that are similar, like per ethnicity. I mean, of course, it's not always the case, but and as we get into mixed race, it gets more like it gets different. I mean, it's even less homogeneous, but uh, there is an art and an understanding of certain noses that helps you then create better surgical results. So some patients specifically look for like ethnic rhinoplasty or Asian rhinoplasty, because they want someone who sees a lot of that. And I think those patients should be able to narrow their surge down, and they have a right to that. And doctors or surgeons need to understand that there are nuances between those different noses. If you went in to an ethnic nose and did the same exact surgery that you would do for a Caucasian nose, the results would not be great, because the anatomy is different. And I think it's okay to acknowledge that there are differences amongst us, amongst our different races and ethnicities, and it's all beautiful, but it is different, and so you have to approach it properly. So I don't have a problem with that. I actually see some positives to calling it that, believe it or not. But I also understand in this day and age why some would think that that's I don't know, like, not PC or problematic. So I get that too, but it's not in our specialty or in the field. It's not coming from a place of putting anyone down or saying that one type of nose is worse than another or anything like that. That's not how how we think about it. Oh, it's something about Elon. Elon will be in that field once he lands on Mars. Might start to flight from Earth to his new home. I don't even know what that was a reaction to, but whatever. Have you done a surgery breakdown on Bella Hadid yet? Think about that. Think
Yeah,
that
there's
would be interesting.
a lot of requests I'm keeping track of, but yeah, multiple
Yeah.
people want Bella, and I don't think you've done only Bella.
No.
Yeah, no,
No.
and Megan Fox too.
Megan Fox
had
is
the
coming up.
Housewives.
So our next one, oh, the Housewives. Oh yeah, yeah. There's lots to do, lots to do. Yeah, I finished filming Jamie Fox. I have Megan Fox. I have her pictures. I have to just analyze them. But Jamie Fox and his hair transplants, that I've already filmed. So Marco's gonna get to editing that sometime soon. But I think the next video, like I mentioned earlier, is going to be surgical hairline advancement, a surgical showcase. So that will be super interesting because that's the whole surgery. And that specific surgery went super well. And so I'm excited to share that one with you. I think that's going to come out on Wednesday. And then for over the weekend, we're trying to push things with the Cassandra Bankson team to put out the videos from our collaboration, where there'll be a video on her channel and video on ours. And so we touch on celebrities and like things that have gone wrong, and a lot of actually like deeper like psychological things that I didn't even think we would get into, and honestly certain things that I was like stumped on, like Oli London's um like trans racial surgery, right? Where he says that now he associates with being, he's like, I think he's British, right? But he associates now with being South Korean because he tried to transform himself into like one of the BTS members. So like, yeah, I mean, weird, right? And initially I thought like, yeah, what is this trans racial surgery? I mean, I've never really heard of that before, and this and that. But I think when you take a step back and you think about a lot of people, doing surgery in the past and even today to look more white or more Caucasian, uh, and we see that with certain celebrities, even like that is or can be construed as also transracial. So I think like, I don't know. I think it's sometimes easy to pass judgment on someone without really taking like zoomed out view at the reasons why people do certain things, um, and how that is kind of accepted or not accepted by society. One thing though that we talk about in that collaboration is this guy who goes by Black Alien. He calls it, I think if you like Instagram Black Alien Project, you'll see this dude who I don't know which country he's in, but he wants to look like an alien, and he's had most of his body tattooed like black. Um, he's cut off like different fingers, like on his hands, to look like claws. Like body modification. He's cut off his ears. He cut off his nose. He had his tongue split. He cut off part of his upper lip, and I had a very like when I first heard about that guy before Cassandra's team. This was like months ago. Someone told me about him, and I looked him up. I had like a very like this very disturbed feeling. I almost felt queasy, and I've thought about like why that is, because I mean, I've done those types of surgeries for people who've had cancers, and we're trying to cure them by removing certain appendages. But to see someone doing that, to just look a certain way and feel a certain way, I don't know. I couldn't get my brain to have compassion for him, or I just thought it was just so disgusting. And the main reason being that you're taking these very special things that have been given to us, like our ears, our nose, that serve a very functional purpose, and you're just like cutting it off and getting rid of it. So, yeah, that to me was disturbing, because I know people who they're not privileged to have good hearing, for example, or a nose that works properly, or whatever the situation might be. I've met these people, or they get cancers in places where they didn't do anything wrong. It's not from smoking or something. They just kind of have bad luck, and they're fighting for their lives, and they get their nose cut off because of cancer. And imagine what that does to your life. And here's a guy who just decides, electively, to just do that for no reason other than to look like an alien. I don't know. I thought it was so weird. So we touch on all these interesting things, and it'll be a lot of food for thought for everyone. So that will be exciting.
I'm giving you a 5-minute warning.
I have a 5-minute warning from the wife. Okay, what
Someone
else?
had asked, this was, how do you deal with being confident while having sudden and dramatic hair loss, especially since this is your career, along with being on social media? I'm sure some people here can.
How do you deal with
relate.
being confident? Yeah, and when I was looking at some of the comments when we posted in the community about this live chat, people were saying like, "Oh, I'm losing hair. I don't know like what to do, and I'm losing confidence." And yeah, I touched on this a little bit earlier in the chat, that like for me, doing these videos and being in front of all you guys, like it's kind of cathartic, actually. Like just kind of owning it and not feeling like I have to hide something. That helps me. But yeah, confidence. I don't know. I think some of it is just a personality trait. I think, and I'm not always confident about every little thing, right? I mean, no one is. But I think you come at it from like the right perspective. And I think the more positivity and confidence that you exude, the more of that positivity and respect you get back. So sometimes it's hard to kind of generate, right? But once you do, you'll get it back. So yeah, so people like usually respond, I think, in much nicer ways than some people think they will. Um, and maybe not if you're like a big time celebrity, but also I think you have to surround yourself by like really like loving people. Like I'm really fortunate. I have a great family. So having that support from them from the beginning, where they don't care how I look, it's just like it's just me. Um, that of course gives you a lot of confidence. And then you bring that into other spheres as well. So that's my biggest recommendation: just find people who, are like, the love that you get from them is not conditional on your looks, or on a lot of other things. It's more unconditional love, and then take all that positive energy and put it into your work, and don't care, don't care so much what others have to say. I mean, in the beginning, also with this channel, we definitely were seeing like some of the nasty things that some people would write, or some of it stemmed from just ignorance and not understanding that I had this condition, and I was talking about hair. I get why people would be confused by that, but doing a little bit of digging, and they figure it out. So initially it was kind of a scary thing, and also like my feelings were hurt a few times, and then you see certain things over and over again, and you're like kind of desensitized to it, in a way. And again, mostly it's a lot of love. So I definitely encourage people to like step out of their comfort zones, and do more social media, get out there more to socialize when hopefully this whole COVID thing, quiets down, I guess. And yeah, and just try to feel good in your skin. And that's where, sometimes plastic surgery can be helpful with that, but a lot of times it's just generating that positive feeling deeper inside. So that's
That was really nice.
Liz liked that answer. So am I getting a hug? Okay, I'm getting a hug. All right, all right. All right, guys. So yeah, so that's great. So yeah, so sorry. I know you guys sometimes wish I answer more questions. I try, but then it's like, there's just so many things happening. And I try to give longer answers when possible. So great. More thumbs up gets the live more engagement. Okay, yeah, let's do thumbs up. I can't like my own live. All right, guys, this has been really fun. Thanks so much for the donations, and we're raising a lot of money for the National Alopecia Areata Foundation, and they actually messaged me the other day. I can find it here on Instagram, and they were just like thanking us for all the work we're doing here together online. Let's see, from the National Alopecia Areata Foundation.org. They said, thank you for the thorough and factual breakdown of types of hair loss in women. And thank you for everything you're doing to raise funds and reduce stigma for alopecia areata. So listen, whatever I can do, I just think people ought to, talk about it more and educate the public so that people know what's going on. Yeah, great. Thank you guys so much. Thanks for watching the videos and for all your feedback in the comments. We really do read the vast majority of them. We just can't always find the time or the energy to reply to everyone, but we'll continue to try. And yeah, and that will be good. Do you have any single brothers ready to mingle? I'm an only child, so no, but I have a brother-in-law. He's going to be a dermatologist. He's going to derm residency next year, so it's a good catch. All right, guys, this has been fun. Have a good night. Talk soon. Bye-bye. Get the sweatshirts. I feel beautiful hoodies. If you call them sweatshirts, they're hoodies. And we'll come out with some more merch in the near future. And Liz didn't want me to tell you guys we're working on a scar gel, but we are. So one day that will be out too. I need your bro-in-law. That's right.
I'll show.
Okay, we'll share this chat with him. He'll appreciate it, and maybe I'll feature him on the channel one day.
Oh, yeah,
He's a little shy, but we'll get him on. All right, guys. Thanks so much. Bye.